Hello, everybody, and welcome to Project HR, a podcast dedicated to building better workplaces. Project HR is brought to you every Thursday by Projections, an IRI company. IRI helps organizations navigate workplace challenges, improve employee engagement and productivity, manage labor relations, and implement effective communication strategies to achieve their goals. For more information, you can visit IRI online at iriconsultants.com and Projections at projectionsinc.com. I'm Jennifer Orqua, Director of Business Development for IRI, and your host for today's episode of Project HR. Now, workplace violence continues to be an issue that every organization must acknowledge, attempt to prevent, and at the same time prepare for. In the United States, there are roughly 2 million victims of workplace violence each year, and recent data shows that healthcare and social service workers are 5 times more likely to be subjected to workplace violence than workers in any other industry. However, in general, and in every industry, the pressures of work and home life combined now with the ongoing stresses surrounding the pandemic, the economy, and the political and social divisions within our country all seem to be setting the stage for increased violence within our workplaces. My guest today is William Marcisz. William is the president and chief consultant for Strategic Security Management Consulting. SSMC are workplace violence prevention experts, and he is here to help guide us through this difficult but necessary topic. Bill, thanks so much for joining me here on Project HR.
Oh, thanks for having me, Jennifer.
So, Bill, what kind of behaviors are included in the terms workplace or occupational violence?
Typically, when you hear workplace violence, you're thinking about written and verbal threats are probably the most common. Harassment, bullying, sexual harassment, cyberbullying
Mm,
is also a big thing right now, and it runs the whole gamut up to physical assaults with or without weapons, and sexual assault, and even homicide in
mm.
some areas.
So, who's most vulnerable to workplace violence? I mentioned in the introduction that healthcare workers are very much at risk. And we'll be talking about them specifically in a minute. But are there other industries or jobs that put workers at greater risk than others?
Well, like you said, healthcare, they're probably right at the top of the list. It's a whole different section of workplace violence, I guess you could say. But police officers are probably up there.
Mm,
Anyone who's in a service industry, customer service type role, those folks have a lot of customer contact, and they're really at the pointy end of the stick for issues and
mhm,
hot button issues that are related to things that an employer needs to enforce. So we just went through a pandemic. We're actually
mhm.
still going through it, and the issues with wearing masks and have you been vaccinated
Mhm.
and stuff like that seem to be these poor folks are the ones who are taking the brunt of
For
that.
sure. Yeah, for sure. And we talked about the effects of the current world situation and how these factors might be setting the stage for increased incidents of violence in the workplace. Are we seeing increases since the beginning of the pandemic?
Yes, absolutely. For those reasons that I just mentioned, and I know in hospitals in particular, I'm in touch with a lot of different healthcare security professionals,
Mm.
and it's almost unanimous across the board. We are seeing workplace violence increases from anywhere up to 10 to 40% in some organizations.
So would you say that the rise of remote work has helped in any way to mitigate workplace incidents or not really?
Well, yes and no. Remote workforces have their own set of issues. Well, first of all, when employees are out of the building, that eliminates some workplace violence. So
Mhm.
as HR folks, you're used to dealing with what they call type 3 workplace violence, and that's employee versus employee. Removing folks out of that context where they have constant contact with each other and basically getting under each other's skin,
Mm.
uh, those issues kind of went away. But then they manifest themselves in other ways through, now everybody's working remotely and connecting
Mhm.
virtually.
Mhm.
So maybe there's ways people are texting each other or instant messengers
Mm.
and
Mhm.
through Teams chats and things like that.
Mhm.
There's also another aspect of workplace violence that's starting to come to the forefront recently with regards to remote workforces, and that's an employer's duty to keep their employees safe, and when they have designated that employee as a remote worker. And I know a lot of organizations have been working through this for the last couple of years. at the beginning kind of forced into it. You have employees who may not be safe in their home. Think about employees who live in an abusive relationship. So now, you know, their workplace used to be their sanctuary, and now
Mhm.
they're stuck in
Mhm.
in
Mhm.
they're a captive audience there. So it's those types of issues, and it's starting to manifest itself or blow back on the employer to make sure that their employees are safe while
Yeah.
they're at home. So
Yeah.
these things are still working themselves out, and I imagine they're going to start working their way through the court system and other regulatory venues such as
Mhm.
OSHA and other agencies that have oversight over that.
Yeah, that's interesting. I'm sure a lot of employers aren't necessarily thinking about that domestic aspect of the workplace where people are working remotely. All right, I'm going to take a quick sponsorship break right now, but when we return, Bill and I will discuss ways to protect at-risk workers, including those vulnerable healthcare and social service workers. So stay with us.
So, you've provided your supervisors with the training they need to create a positive environment and keep your company union free. But can they put that knowledge into action? Wise Words e-learning will teach your supervisors how to respond appropriately to tough employee questions about unions, including questions about dues, collective bargaining, promises, and more. Based on solid adult learning theory, Wise Words guides supervisors, helping them practice their skills in a fun and engaging format that sticks with them over time. Wise Words e-learning is delivered in microbursts of learning and is available online 24/7. Your leaders can practice their skills anytime and anywhere there's an internet connection on any device. Wise Words training will protect your company from ULP charges and give your leaders the confidence to connect with employees. Learn more and sign up for a demo at projectionsinc.com today.
I'm back with William Marcisz, President and Chief Consultant for Strategic Security Management Consulting. So, what's the liability involved if we don't protect workers against this kind of threat?
Yeah. So OSHA has a general duty clause that this comes under for to hold employers accountable for employees who are victimized by workplace violence. So OSHA can come in and conduct an investigation, fine an employer. There's also legal liability. So if something happens and an employee is injured and they file a lawsuit against the employer, that is also a possibility. Interesting that you brought that up because I'm also doing a webinar on negligent security.
Hmm.
And one of the things that I'm seeing in negligent security actions is that juries are coming back with multi-million dollar verdicts
Mhm.
against employers. A few months back, a hospital down in Arizona, a jury came back with a $9 million verdict against the employer for, I think it was a negligent training
Hmm.
issue where a patient attacked a staff member. So
Hmm.
I believe that was the fact pattern, but I know these verdicts are coming in. They are in the seven-digit figures,
Mhm.
and it's starting to catch a lot of people's eye. As a security consultant, I am getting calls on cases involving employee victims
Mhm.
in the workplace. So I could tell you that this is happening out there.
So, are zero tolerance policies are they enough to protect workers from harm and companies from liability?
Yeah, good question. A zero tolerance policy is important for employers to communicate to their staff. What it says is that we care about you. However, without an effective workplace violence prevention program, a zero tolerance policy is really just a statement. So you have to have things to support your employee. You have to have a solid workplace violence program and plan
Mhm.
in place to make sure that that zero tolerance has some teeth to it. If it doesn't, and employees are continuously victimized, and they see that there's this zero tolerance policy out there, but it's not really helping, that could come back and hurt the employer.
Clearly, as employers, we need to keep our workers safe. What can employers do to protect at risk workers?
Workplace violence prevention is very complicated. It's not an easy thing to solve or resolve, and it takes a lot of different components to it. So solutions are both what I call overt and covert. So you could have a policy in place, and you could have what I call overt security measures. So you could have an actual standing security force with defensive weapons like tasers and batons and things like that. You'll see that in hospitals. So, and hospitals will have like canines and a lot of cameras and stuff like that. But the
Mhm.
covert stuff is really the built-in processes to, how do I deal with this upset customer? Do my coworkers and I have a plan on how to address this? Who takes the lead? Is there a lot of training and education involved in customer
Mhm.
service? So those are some of the things that can be done. One
Mhm.
thing, I kind of see a little bit too from my consulting is that sometimes there's a little bit of a disconnect between executives and administration and line personnel. And some of the reasons for that is not that anybody is intentionally or being negligent and not wanting to provide a safe environment.
Mhm.
It's some of the processes that we look at when you take a look at how things are set up in the workplace. So you have productivity and bonuses. They're
Mhm.
driven by fiscal performance. And when you mention something like safety and security, sometimes those are areas that get neglected because they're not really revenue generating areas. So a business might make a decision, says, I've got $1 million in profits from last year. I could invest all that into, things that are going to make me more profits, or I can invest them into safety and security, which isn't going to make money.
Mhm.
So it would be great if we could see safety benchmarks and metrics become some of those things that drive an executive's bonus. It's like, did you create a safer work environment where your workplace violence incidents down from last year? Well, then you get an extra 1%
Mhm.
of bonus instead of just having it based on fiscal productivity.
Mhm.
So, shifting gears here a little bit, what should an employer do following an incident of workplace violence? Is there a strategy? What's the correct response?
Yes, so it depends on the type of the incident and the severity. Um, if is it a threat or is it an actual injury that resulted from an altercation?
Mhm.
These are you kind of have to work off those two concepts.
Mhm.
What I would say is for an employer, don't ignore it. And
Mhm.
certainly EAP is an option depending upon it. How was that person impacted? I would also make sure that you have supervisors after the fact who are really cognizant of having that incident occur to that employee. Continue to monitor that employee, because a lot of times an employee will just say, "No, no, I'm fine," and then things start happening weeks after the incident,
Mhm.
and start manifesting themselves. So
Mhm.
I, I think employers would do well by listening to staff and other staff, and if they were impacted by workplace violence.
Mhm.
The other thing employers should do is watch for disengaged staff using safety as an incident or an incident that occurs to kind of drive a wedge between management and create discontent among their coworkers.
Mhm.
I see that quite a bit. It manifests itself in poor engagement scores, and safety is something that they'll exploit for
Mhm.
their purposes.
Yeah.
For severe incidents, injuries or threats, I think an organization should have a threat assessment team that's trained and has some education in that specific discipline. That may be a route for that. If an injury occurs, a root cause analysis, sometimes driven by either HR or risk management.
Mhm.
Is there something that we can do here from a physical standpoint that could have prevented that? So these are the types of things you would want to
Mhm.
And also bring in resources, legal, security,
Mhm.
a threat, There's threat assessment specialists out there, security consultants like
Mhm.
myself,
Mhm.
leverage marketing. And because sometimes they have a social media monitoring platform for their
Mhm.
business, and that could be
Mhm.
utilized.
Mhm.
Law enforcement, sometimes even community partners could be brought in. So it really depends on the type of the incident, but there's help out there. Don't think that you have to do this yourself.
Mhm. So let's talk a little bit about that healthcare and social services worker statistic that I mentioned earlier. Why is the sector so particularly vulnerable to violence? And we talked about, issues over mask wearing and things, but why does it make healthcare and social services workers more vulnerable?
Sure. Let's set aside the pandemic issues for
Mhm.
a minute here.
Yeah.
And so hospitals, you think about a hospital, and these are places nobody wants to be at, except when maybe a baby is born. There isn't a lot of reasons why people are saying they're jumping for joy to be there.
Mhm.
So,
Mhm.
so the reasons why they're brought into a hospital are usually, somebody's sick or um,
Mhm.
has some severe injury or something bad has happened. So there's a lot of stress and anxiety, and that's both the patients, that's the guests, the
Mhm.
family members of those patients, and it's the staff too.
Mhm.
There's concern about the unknown. So you're sitting there, you're waiting for your test results, or
Mhm.
you're worried, oh my God, how much is this going to cost? And is my insurance going to cover this? And
Mhm.
so there's the stress and anxiety. Then there's the high risk patients that are also in hospitals, behavioral health, substance abuse, and the state resources for these classes of patients are starting to dry up, and
Mhm.
there's really no place for them to go except to the hospital, and sometimes they're housed in an emergency room for days, and
Mhm.
they're sitting there wondering, where am I going to go, what's going to happen, and their anxiety just continues to build and build and build, and then they blow up.
Yeah.
The other issues in a hospital are, think about domestic violence. When you have a staff that is 80% female, and 1 in 4 women is a victim of domestic violence, that's a lot,
Mhm.
and so that's something you have to think about. Other domestic violence is brought into the hospital by family members of patients or the patients themselves. You have maternity units.
Mhm.
Think about those situations where dad wants to come in and visit, but the husband's there,
Mhm.
and these are real life
Mhm.
situations. I know it's a Jerry Springer moment, but it's these are the things that hospital staff and security have to work through.
Yeah.
ICU,
Mhm.
family members with long-standing grievances coming together, and then mom or dad or granddad is not doing well and not expected to live much longer than, and they're already arguing about the will.
Mhm.
Uh, these are the things that hospitals deal with, in addition to like gang violence,
Mhm.
and and then we get into the pandemic issues. We
Mhm.
talked about the frontline workers and staff having to really enforce these safety precautions, because what people don't think about is, when in a hospital people are sick, and when people are sick, their immunosystems are really compromised, and
Mhm.
that makes them so much more susceptible to getting something like COVID, or even, it doesn't have to be COVID, it could be something
Mhm.
else.
Mhm.
And if folks don't understand that, hey, listen, I'm feeling fine. Why do I need to wear a mask? Well, you might be a
Mhm.
carrier. You're young and you're healthy, and but you still might have it. And if you bring it into a unit where all these folks are don't have those defense systems to ward off those. These are why staff members really have to enforce these
Mhm.
rules. So,
Yeah. Yeah.
and the pandemic just kind of made things worse.
Sure, sure. So you covered a lot of ground there. It sounds like most of the violence in healthcare environments comes from outside the organization, which may not be what most of us think about when we think about workplace violence. But how does that impact a prevention or a response strategy?
Yes. So in a hospital, 85% of workplace violence, and that's per the International Association Healthcare Safety and Security Annual Crime Survey. 85% of workplace violence is what they call type 2 workplace violence, and that is a patient or visitor is victimizing an employee.
Hmm. So how does that change our response to it, or does it?
It changes the response in the sense that you require more of a overt type of those security measures. So, hospitals use both deterrence and prevention strategies. So,
Hmm.
your security force in a hospital tends to look more closer to a police officer rather than a softer look that you find in a hotel with a blue blazer and
Hmm.
nice dress
Hmm.
shirt.
Sure.
You'll have to put tasers and batons and pepper spray,
Hmm.
handcuffs, sometimes even firearms
Hmm.
on your security force.
Yeah.
Hospitals invest extensively in technology in terms of closed circuit television, access controls, duress buttons. Even in the security force, you're starting to see things like body cameras, which are really great for de-escalating folks.
Hmm.
I did this for a healthcare organization I was a security director at. We implemented body cameras mainly just as a check and balance to hold our staff accountable.
Hmm.
But in the process, what we found was that you put the body camera on and then you said, just to let you know, we're recording this conversation. So somebody is agitated and you've just told them that and they were just looking to be very obnoxious and rude. All of a sudden they're placed in this situation like they're being recorded, and it's like, oh, well, I don't want to be recorded acting like an idiot. So
Hmm.
they'll they'll actually de-escalate from that, and canine programs too. They become kind of a nice deterrent for behavior, and they also help de-escalate situations. A lot of people love dogs, and
Hmm.
the dogs calm people down,
Sure.
and they're really a great tool for a security officer to segue into a conversation and
Hmm.
help kind of diffuse the situation.
Yeah.
Also, formal threat management teams. I can't stress that enough in making sure that we have those in place.
Hmm. All right, Bill, it's time for another quick break. We're going to be right back after this. You're listening to the Project HR podcast. I'm your host, Jennifer Orqua, and my guest today is William Marcisz, President and Chief Consultant for Strategic Security Management Consulting. We're back. And on January 1st of 2022, a new and revised workplace violence prevention standards, they were applied to all Joint Commission accredited hospitals and critical access hospitals. In advance of that, you published an article on LinkedIn explaining what those new standards would entail. Can you summarize these new requirements for us?
Yes. So in healthcare, there's accreditation bodies, and one of those is called the Joint Commission. The other one is most widely used as DNV. So they have certain standards that they hold the hospital to in terms of workplace violence prevention measures. Workplace violence just started gaining some, I don't want to say notoriety, but it started getting a little bit more attention about 10, 12 years ago when the Joint Commission issued what they call a Sentinel Alert on workplace violence. Then OSHA and a lot of different regulatory bodies started creating not standards, but guidelines. And some of these moved into standards.
Hmm.
But the standards were still kind of a little wishy-washy. What the Joint Commission did with these new requirements that they just implemented beginning in January is they've actually put some teeth into those standards that were out there and were subject to manipulation and interpretation so that hospitals didn't necessarily need to do some of the items there and it kind of just let things it just wasn't a good system, I thought, anyways. But there's a couple things in there. First, there's leadership accountability. So they've created a standard holding the executive leader for the organization accountable to make sure that employees are trained. They've make sure that there's security and hazard control systems in place, making sure that incidents of workplace violence are being reported and investigated. So, and then also that hospitals are following up with those investigations to make improvements. Those root cause analyses I was talking about earlier.
Mhm.
We find out, well, this could have been prevented if we had a protective barrier over here, or had that staff member been trained. And that was another component too. They also attached requirements to HR to make sure that training is completed. In hospitals, you need several tiers of training, especially for employees who are at high risk for a violent encounter. So if you work in an emergency department or behavioral health unit, or if you're a security officer, there's a good chance you're going to end up in a physical confrontation with
Mm.
combative patients. So those staff members get a certain level of training that is higher than most other staff members. So they've clearly indicated what training for those types of folks. They've made sure that threat management teams are part of your workplace violence prevention program, and also the reporting has to come through a top to bottom accountability, or bottom to top really,
Mhm.
because the reporting goes up,
Sure.
and they ask for certain metrics to be recorded, and then it has to go to like a quality or even a board of directors sometimes.
Mhm, mhm, and I understand from the article that many hospitals have now created a position within their administrations for a workplace violence manager position. Can you tell us why this role might be a worthy investment?
Yes. And the thing that a lot of folks don't understand about workplace violence management from an employer standpoint is that this isn't a security problem. This is not a risk management problem. This is not an HR problem. This is everybody's problem. And the Joint Commission even says it in their standards. You must have a multidisciplinary approach to workplace violence. So, and let's face it, not everybody is up to speed on workplace violence, and not everybody has a workplace violence expert in house, and that's okay as long as somebody's there who can help guide the process. But everybody has to participate, and that's really the essence of these new guidelines. It forces
Mhm.
participation, really.
Yeah. So let's talk a little bit about third party workplace violence consultants like strategic security management consulting. What are the benefits of using someone from outside the company to provide prevention, response, and recovery services?
It's really to get out of your current thought processes. Having somebody come in from the outside to take an independent look on things kind of adds fresh eyes to the situation. And sometimes there's personalities in your chain of command, and they have preconceived notions on things. When you bring in an expert who can kind of cut through all that and just say, hey, listen, this is what you need to do, they don't have any, they're not bringing in any baggage,
Mhm.
so they're just good to have. The other
Mhm.
thing is that in healthcare security, in particular, because security is a big player in workplace violence in hospitals,
Mhm.
it's a best practice now to bring in an independent consultant at least once every 5 years to evaluate your security program, and you can't not look at this workplace violence program because they're so intertwined.
Mhm.
So I
Mhm.
think that's really the benefit is, yeah, it checks off a box saying that, yes, I did this. And the Joint Commission or your accreditation body will like that. And also, if
Mhm.
you're sued um, because of a workplace violence issue, you could always, it's a good defense
Mhm.
strategy just
Mhm.
to say,
Sure.
hey, listen, we had this expert in here 2 years ago, and this is what they told us, and we did this, and you know,
Mhm.
and that helps your case.
And so, on that note, what specific services does SSMC provide?
Well, we're a full service security consulting firm. We go across all industries, hotels, casinos, healthcare, schools, apartment complexes. We provide a host of security assessment processes, whether it's a vulnerability assessment, whether it's a security risk assessment. The other components of what I do is I serve as an expert witness. I review cases for attorneys regarding negligent security, excessive use of force, negligent hiring, retention, supervision, those types of claims. The other thing I do is I serve as a virtual consultant ongoing for certain healthcare organizations, and other organizations bring me in to do workplace violence consulting.
Okay. Yeah. So do you have any success stories you'd like to share?
My success story is when I was actually a security director. I was working at Advent Health at the time, and we developed a very solid security program there. We went on to gain some national recognition. So in 2019 we were awarded the Lindbergh Bell Award for most distinguished healthcare security program. The next year, the American Society for Industrial Security, which is probably the largest professional trade organization for security experts, they gave us the award for most outstanding security program. So we ventured beyond just healthcare, but all of security. And then in 2021, I was honored to receive the in-house most outstanding performance by an in-house security director, which was
Nice.
really, I was really honored for that. It's
Sure.
when you have 34,000 members worldwide in an organization and they give you that award.
Yeah, for sure. So if I want to find out more about you or about SSMC, where can I go?
I would go to my website, www.ssmcsecurity.com. You can Google Strategic Security Management Consulting, and it should come up within the first couple of hits there.
All right. And I want to let our listeners know that those links will be included in this episode's companion guide. So be sure to unlock that today at projectionsinc.com/podcast. Right now, though, Bill, it is time for my lightning round questions. And these are questions I ask of every guest of the podcast. Are you ready?
Fire away.
All right. So our first question is always a topic showdown. In this episode, we've been talking about workplace violence. In your opinion, Bill, which of these elements is more critical to workplace violence prevention? Comprehensive safety education for employees or security equipment upgrades?
Both.
Very good. I'll take that answer. All right. Next question. What is the best book you've read recently?
Well, I use Mad Magazine for most of my research. So,
Okay.
no, seriously. I just read Devil in the White City by Eric Larson. The book's been out there, but I just happen to read it now. And I like to, for me, I like to plan and build things. And I'm also an expert in violent crime. So that book kind of hit all the notes for me. So.
All right. What's your favorite thing about the work that you do?
The work is fast paced and the scenery changes. I get to go into different places and I'm constantly challenged by the different analysis and strategic thinking and the problem solving, because no two hospitals, no two businesses are exactly alike. They all have different cultures and different organizations charts and things like that. So it's fun to solve problems for them.
Yeah, definitely. All right. Next question. What is the best piece of advice you've ever been given?
Take responsibility for your own destiny. Believe in yourself. Trust your instincts. Take risks. Make your own luck. Success is just a byproduct of hard work.
That sounds more like a mission statement. That's a good piece of advice. All right. Last question. Who or what inspires you?
I like people who persevere and people who have tenacity and just never give up. And then people close to me who are an inspiration. My late dad and grandfather, I always looked up to them. My grandfather's an immigrant to this country, came over with just his clothes on his back, and our family was just part of that American dream, and one generation doing better than the next. And of course, I have a daughter who's autistic, and just watching her go through life and just the challenges that she has, and those are the things that kind of just inspire me.
Yeah, inspirational for sure. Thanks so much for joining me today on this week's episode of Project HR, Bill.
Absolutely. Thank you for having me.
I just also want to thank our listeners. And once again, this is your reminder to grab that companion guide for this episode at projectionsinc.com/podcast. If you'd like to be on Project HR or you know someone who would, feel free to email us at projecthr@projectionsinc.com. And last but certainly not least, remember that a new episode of Project HR drops every Thursday. Make sure you never miss an episode by subscribing to the podcast. Drop us a line, leave us a review, or give us a handful of stars wherever you get your content. That's it from me for now. Let's make it a great day at work.